Most people over 70 are told the same thing when their ankles start to swell. Just put your feet up and cut back on salt. It sounds sensible, it sounds safe, and it is not wrong exactly. But here is what almost nobody tells you. Putting your feet up alone does not fix why the fluid is pooling down there in the first place. And it does nothing to protect the one thing you actually care about, which is staying on your feet. In vein clinics and physical therapy offices across the country, swollen legs are one of the most common problems that walk through the door every single day. And in the large majority of older adults, that swelling is not coming from a failing heart. It is coming from a slow, quiet breakdown in the plumbing that carries blood back up out of your legs. So in the next few minutes, I am going to give you 5 specific things you can start doing at home to move that fluid up and out. And I am going to explain one piece of your circulation that a 12-minute appointment almost never has time to cover. The number 1 item on this list is something hardly anyone talks about, and it works like a second heart tucked inside your own legs. Stay with me all the way to the end, because that one habit can change how you move for the next 10 years. Now, let me be honest with you about why this problem gets missed. A typical appointment for swollen legs lasts about 12 minutes. In that time, your doctor has to rule out the dangerous causes first, and that is exactly right, because some swelling is serious. If one leg suddenly swells up on its own, especially with pain, warmth, or redness, that can be a blood clot, and you need to be seen the same day. If your swelling comes on fast with shortness of breath or tightness in your chest, that can be your heart or your lungs, and that is an emergency, not a home exercise. Please hear me on that one. But once those serious causes are ruled out, and for most people they are, the appointment is basically over. There is no time left to explain the everyday mechanical reason your legs swell or what to actually do about it. So you get sent home with put your feet up and watch your salt, and nothing really changes. I want to be clear about something. I am not here to sell you a supplement or scare you into a course. This channel exists to give you the science a 12-minute appointment never has time to cover. No pills to buy, no gadgets, just how your own body works and how to work with it. Because this is not really about how your ankles look. Swollen, heavy legs make it harder to get out of a chair, harder to climb the stairs, harder to walk to the mailbox without your legs feeling like sandbags. Left alone for years, the skin can harden and break down, and that is when swelling stops being a nuisance and starts stealing your freedom. So tell me in the comments where you are watching from and how old you are. And if you have to peel your socks off at night because the elastic leaves a deep ring around your ankle, type the word ring because that ring is a clue we are coming back to. Here is the one mechanism behind almost all of this. Getting blood down into your legs is easy because gravity does it for free. Getting it back up to your heart is the hard part because it has to travel uphill the entire way. Your body does this with veins that have tiny one-way valves inside them, like a staircase of little doors that only open upward so blood can climb but never fall back down. Think of it like a canal built with locks going up a hill. Each lock lets the water rise one step, then closes so it cannot slide back. Now, what pushes the water up through those locks? In your legs, it is your calf muscles. Every time your calf squeezes, it acts like a pump, driving blood up through the valves towards your heart. That is why your calves are sometimes called your second heart. When those valves get leaky with age, or the calf pump sits idle because you are not moving, the water backs up in the lowest part of the canal, which is your ankles and feet. That backed up fluid is the swelling you see. Please do not skip this part. It is the key to everything that follows, because every single item on this list works by fixing one part of that pump and valve system. If this is already making sense to you, tap the like button so more seniors can find it. That one tap tells YouTube to show this to someone who has been rubbing their swollen ankles at night with no idea why. Let us start the countdown at number 5. Cut the hidden sodium in your food. Notice I did not say stop salting your dinner. The salt on your table is rarely the real problem. Here is why sodium matters for swelling. Sodium is like a sponge for water. Wherever sodium goes in your body, water follows and stays put. When you take in more sodium than your kidneys can clear, your body holds onto extra fluid to keep everything balanced, and gravity pulls that extra fluid straight down into your legs and ankles. So a salty dinner does not just nudge your blood pressure. It can leave you a full ring size bigger around the ankle by morning. The fix is not zero salt. It is finding the hidden salt you did not know you were eating. The American Heart Association recommends most older adults aim for well under 2,000 milligrams of sodium a day, and ideally closer to 1,500. Large reviews of blood pressure and fluid balance have shown for decades that lowering sodium lowers fluid retention. So here is exactly what to do. For 1 week, become a label reader. Before you buy anything in a can, a jar, a box, or a bag, look at the milligrams of sodium per serving. Anything over 400 milligrams a serving is a high salt food, and the big 3 offenders for people your age are canned soup, deli meat, and bread. Yes, bread. Swap your canned soup for a low sodium version. Rinse your canned beans under the tap for 30 seconds to wash off up to 40% of the sodium. And move your biggest meal earlier in the day so you are not holding fluid while you lie flat all night. Do not try to hit the target in 1 day. Cut 1 high salt food per week so your taste buds adjust and it actually sticks. Now, a safety note. If you take a water pill, what doctors call a diuretic, or any medicine for your heart or blood pressure, do not slash your salt dramatically overnight because that can drop your pressure and leave you dizzy. Talk to your doctor first about how low to go for you, and if you ever feel lightheaded standing up, that is your signal to stop and sit back down, not to push through. Pair this with drinking enough plain water through the day. It sounds backward, but when you are even slightly dehydrated, your body clings to sodium and fluid even harder. Steady water actually helps your kidneys flush the excess out. But cutting sodium only changes what goes into the canal. It does nothing to push the water that is already pooled in your legs back uphill. For that, you need to switch the pump back on. And that pump is a muscle most people over 70 have quietly stopped using. Which brings us to number 4. Number 4, wake up your calf pump with ankle pumps and heel raises. This is the single most underused tool for swollen legs, and it costs nothing. Remember the second heart. Your calf muscle is the engine that drives blood up out of your legs. When you sit for hours, that engine idles, and the fluid just sits in your feet. The moment you flex your foot and squeeze that calf, you are physically pumping fluid upward through those one-way valves. Think of it like squeezing a tube of toothpaste from the bottom. Every squeeze moves the contents up and toward the opening. Your calf does the exact same thing to the blood and fluid in your legs, but only when you actually contract it. Physical therapy research on circulation is very consistent here. Activating the calf muscle pump measurably increases the blood returning from the legs, which is why these are the first exercises taught after surgery to prevent clots and swelling. Here is the protocol. Sitting in a chair, keep your heel on the floor and lift the front of your foot up towards you as far as it goes, then point your toes down away from you. That is 1 ankle pump. Do 20 of them slowly on each foot. Then, if you are able, stand behind a sturdy chair or at the kitchen counter, hold on, and rise up onto the balls of your feet, lifting your heels off the floor, then lower down slowly. Do 10 to 15 of those heel raises. Do this whole set 3 times a day, morning, afternoon, and evening. The slow lowering matters more than the lift, so take 3 seconds to come back down. For the seated version, no balance is needed at all, so anyone can do it, even from bed. For the standing heel raises, always have the counter or a solid chair in front of you, and never do them out in open space. If you feel your calf cramp or any sharp pain, stop. That is not push-through territory, and if standing makes you dizzy, stay with the seated ankle pumps only. They still work. Pair your ankle pumps with the sodium habit from number 5. Less fluid coming in plus an active pump moving fluid out is far more powerful than either one on its own. It is the difference between bailing water out of a boat and also fixing the leak that let it in. But here is the limit of any exercise you do in short bursts. 20 pumps 3 times a day is wonderful, and it still leaves many hours where you are sitting perfectly still and the fluid creeps right back down. To beat that, you cannot just exercise. You have to change the shape of your entire day, which is exactly what number 3 is about. Number 3, break up your sitting with movement snacks. This is not about exercise sessions. It is about never letting yourself sit still for too long in the first place. Here is what happens when you sit unbroken for 2 hours in your recliner. Your calf pump goes completely silent the whole time, and gravity gets an uninterrupted shift to pull fluid down. Think of your bloodstream like traffic on a highway. Short, frequent movement keeps the traffic flowing. Long stretches of stillness are like closing the road, and everything backs up at the lowest exit, which is your ankles. It is not the total amount of sitting that swells your legs the most. It is the long, unbroken blocks of it. This matches what large studies on sedentary behavior keep finding. Breaking up long sitting with brief movement improves circulation and fluid return more than one long walk followed by hours of stillness. So here is the rule. Every 30 to 45 minutes that you are awake and sitting, get up and move for just 2 minutes. Set a gentle timer if you need to. During those 2 minutes, walk to the kitchen and back, or simply march in place next to your chair, lifting each knee 20 to 30 times. If getting up is hard, do a seated version, 20 ankle pumps right there. Then stand once holding the armrest. The magic number is frequency. 6 2-minute breaks scattered through the day beat one long walk that leaves the other 10 hours motionless. If standing up quickly makes you unsteady, rise in stages. Scoot to the edge of the chair, plant both feet, push up through your arms, and stand still for a slow count of 5 before you step off. Keep a hand on furniture as you move. If you feel dizzy or your knees feel weak, sit back down and try again in a minute. There is no prize for rushing. Pair these movement snacks with a big glass of water each time you get up. The trip to refill your glass becomes your reminder to move, and the water helps your kidneys do their job. 2 habits, 1 trigger. Now, movement fights gravity while you are awake. But what about the fluid that has already settled deep in your tissue? And what about the long hours you truly do need to rest? For that, you need to recruit gravity onto your side instead of fighting it, and you need to do it correctly because most people do number 2 completely wrong. Number 2, elevate your legs, but do it the right way. This is the very advice you were handed, and yet most people get almost no benefit from it because the details are wrong. Here is the mechanism. When your feet are below your heart, your veins are pumping fluid uphill the whole day. When you raise your legs above the level of your heart, gravity suddenly reverses and works for you, draining the pooled fluid back toward your core where your body can clear it. Think of tipping a nearly empty ketchup bottle. Held upright, nothing moves. Tip it past a certain angle, and everything flows down on its own. Your legs are the same. Below the heart, fluid stays stuck. Above the heart, it drains for free. Resting your feet on a low footstool does almost nothing because they are still below your heart. This is standard, well-established guidance in the management of leg swelling and venous disease. The key detail above the level of the heart is the exact part that gets left out of the 12-minute visit. So here is precisely how to do it. Lie down flat on your back on a bed or the couch. Stack 2 or 3 firm pillows, or better, a foam wedge, under your calves and ankles, not just your feet, so your whole lower leg is supported and your ankles sit higher than your chest. Aim for your feet to be about 6 to 12 inches above your heart. Stay there for 15 to 20 minutes and do this 3 times a day. The most important session is the evening before dinner to undo the fluid that built up all day. And while you are up there, throw in 20 ankle pumps to double the drainage. If lying flat hurts your back, bend your knees over a pillow or lie with your legs up against the seat of a couch to form an L shape. That takes all the strain off. Do not prop only your feet on a hard armrest because that can pinch the circulation behind your knee. And if raising your legs ever brings on shortness of breath, stop and sit up because struggling to breathe when lying flat is a sign to call your doctor, not to keep elevating. Pair elevation with your compression, which is coming up next, in a specific order. Elevate first to drain the leg. Then, while it is still drained, that is the exact moment the next item locks in the gains. Because here is the problem with everything so far. The moment you stand back up, gravity goes right back to work, and within an hour, the fluid can creep back down. You need something that keeps working while you are upright and walking around all day long without you thinking about it. That is the number one item, the closest thing you have to a second heart you can wear, and it is where we are going right now. This is number one, the crown of the whole list. Graduated compression stockings, used correctly. Remember that ring the elastic leaves around your ankle at night? Compression is how you turn that accidental squeeze into a controlled, healing one. Let me explain why this earns the top spot. Every other item on this list works in bursts. You pump your calves, then stop. You elevate, then stand. Compression is the only tool that works every second you are wearing it. A graduated compression stocking is tightest at the ankle and gradually looser as it climbs your calf. That gradient is the whole secret. It gently squeezes the fluid from the bottom, where it pools and channels it upward, exactly the direction your failing valves can no longer manage on their own. Think of it as an external second heart wrapped around your leg, a firm, steady hand that supports the vein walls so the valves can close properly again. It is like putting a brace on a hinge that has gone loose. The hinge cannot hold itself, so you give it outside support, and suddenly it works again. That is what compression does for the tired valves in your legs all day, without a single ounce of effort from you. This is not a fringe idea. Graduated compression is a cornerstone of how vein specialists and wound clinics treat chronic leg swelling. It is one of the most studied and most recommended tools in all of venous care. Decades of clinical guidelines put it front and center because it simply works. Now here is exactly how to use it, because the details decide whether it helps you or sits forgotten in a drawer. Start with a mild, over-the-counter strength in the range of 15 to 20 millimeters of mercury, which is firm but comfortable, not the strongest kind. Choose knee-high, not thigh-high, for most swelling, because they are far easier to get on and just as effective for ankle and calf fluid. Buy your correct size by measuring your ankle and calf in the morning and following the package chart, because a stocking that is too tight can do harm. Here is the timing most people miss. Put them on first thing in the morning, before you get out of bed, while your legs are still drained flat from sleeping and the swelling has not returned yet. Wear them through the day while you are up and about, and take them off at night when you lie down. To get them on more easily, turn the stocking half inside out down to the heel, slip your foot in, then roll it up your leg. Never bunch it or fold the top band down, because a folded band becomes a tourniquet. And if your hands are weak or arthritic, a simple metal frame called a stocking donor does the work for you, and it is worth every penny. Now, the most important safety point in this entire video: compression is not for everyone. If you have diabetes, poor circulation, numbness in your feet, or you have ever been told you have artery disease or peripheral arterial disease in your legs, do not start compression on your own. In your case, squeezing a leg that already has a poor blood supply can cause real harm, so you must have your doctor check your circulation first. For anyone, if the stocking causes pain, new numbness, tingling, or your toes turn pale or blue, take it off right away. That is a stop signal, not something to tolerate. And never wear compression stockings to bed unless a doctor specifically told you to. Here is how to stack everything you have learned. In the evening, elevate your legs for 20 minutes to drain them. That is number 2. Then in the morning, put your compression on before you stand up, number 1, to hold that drained state. All day. Take your movement snacks, number 3, and your ankle pumps, number 4, while the compression amplifies every squeeze. And keep the sodium down, number 5, so there is less fluid to fight in the first place. Each item multiplies the others. And there it is, the second heart I promised you at the very beginning. It is really two things working together: the calf pump you rebuild from the inside with movement, and the compression you add from the outside to support it. Between them, they do the job your worn-out valves can no longer do alone. That is the insight almost no 12-minute appointment has time to explain. And it is why the person who understands it can stay light on their feet for years longer than the person who just keeps propping them up. Consider a typical case documented in the rehabilitation literature. A 74-year-old woman came in with heavy, swollen ankles that had crept up on her over 2 years. By evening, her legs felt like sandbags, her socks left deep rings, and she had started avoiding the stairs and skipping her afternoon walk with her neighbor. Her doctors had checked her heart, and it was fine, so she assumed nothing could be done, and this was simply old age. She was started on a simple plan, the same pieces you just heard. She cut the canned soup and deli meat that were quietly loading her with sodium. She began doing ankle pumps 3 times a day and standing heel raises at the counter. She set a timer to get up every 40 minutes. She elevated her legs above her heart for 20 minutes each evening, and once her circulation was checked and cleared, she was fitted for mild knee-high compression stockings to put on each morning. Within about 3 weeks, the evening heaviness had eased noticeably. Her socks stopped leaving those deep rings. By 2 months, she was back on the stairs without her legs screaming at her, and she had rejoined her neighbor for that afternoon walk. Nothing exotic happened. She simply started working with her circulation instead of against it. So let us make this dead simple. Here's your checklist, 5 steps, and every single one has a number, so you cannot talk yourself out of it. Tonight, step 1, elevate. Lie down and raise your legs above your heart for 20 full minutes before dinner and do 20 ankle pumps while you are up there. Tonight, step 2, read 3 labels. Pull 3 packaged foods from your kitchen and set aside any with more than 400 milligrams of sodium a serving. This week, step 3, break up your sitting. Every 40 minutes you are awake, stand and move for 2 minutes, 6 or more times a day. This week, step 4, train the pump. 3 times a day, do 20 ankle pumps and 10 to 15 heel raises at the counter. This week, step 5, the big one, compression. If you have no circulation problems, measure your ankle and calf in the morning and order mild 15 to 20 millimeter knee-high stockings. But if you have diabetes, numbness, or any artery disease, step 5 becomes booking your doctor to check your circulation first before any squeeze goes near that leg. Now think of someone in your life who fights this same battle every evening. A parent, a spouse, a friend who peels off their socks and rubs those deep red rings around their ankles. Send this video to them because the calf pump and the compression trick are the 2 things nobody ever explained to them either. And tell me in the comments which of these 5 you are starting tonight. Are you the elevation person, the compression person, or the sodium person? Your answers decide exactly what I cover next. And if this gave you even one thing your last appointment did not have time for, subscribe to this channel because that is the whole mission here, to hand you the science a 12-minute visit never gets to. This video is education, not a diagnosis. Your own doctor knows your history, so bring this list to your next appointment. I'm Judy Vance. Don't forget to subscribe and live longer.